Bueno, yo como responsable de proyectos en Palestina de Paz y Dignidad, os doy la bienvenida a esta jornada Voces desde Gaza. Inauguramos este espacio con un imperativo ético: nombrar lo que ocurre. No podemos ni debemos permitirnos eufemismos mientras asistimos en tiempo real al exterminio de un pueblo. Lo que sufre Gaza no es una crisis fortuita, es un genocidio planificado por parte de Israel, un Estado genocida e impune que actúa al margen de la legalidad internacional para borrar la identidad palestina. Estamos aquí porque nos negamos a que el silencio sea el epílogo de esta barbarie. Desde Paz con Dignidad, nuestra identidad no se negocia. La paz solo es posible si nace de la dignidad. Y eso, en los territorios ocupados palestinos, significa el fin del apartheid, el fin del asedio y el respeto a la soberanía de su pueblo. Llevamos más de 20 años apoyando el fortalecimiento de la sociedad civil palestina porque sabemos que su mera existencia es en sí un acto de rebeldía. Nuestra labor en el terreno no es asistencialismo vacío. La paz solo es posible si nace de la... Nuestra alianza con la Asociación de Salud y Comunitaria Al-Awda, de quien nos acompaña nuestra compañera Sama Yaber hoy, tiene más de 20 años de trayectoria. A través de esta alianza hemos apoyado diferentes proyectos de ayuda humanitaria, entre ellos el fortalecimiento del sistema público de salud, programas de salud sexual y reproductiva, soberanía alimentaria. Incluso tenemos una cuenta de emergencia activa, la cual activamos el 8 de octubre de 2023, justo un día después, ¿no?, de que se dieran los ataques y el inicio de toda esta barbarie, gracias a la cual hemos recaudado hasta la fecha más de 1 millón de euros, con los cuales Al-Awda ha podido construir una nueva maternidad en la Franja de Gaza, atendiendo a muchísimas mujeres y dando la oportunidad y la dignidad de poder parir y dar refugio a las niñas y los niños recién nacidos. Esto es un ejemplo de resistencia y para nosotras es muy importante, ¿no?, contar aquí con la compañera porque es la viva voz de lo que hemos estado apoyando desde Paz con Dignidad, quienes al final somos la voz de toda la ciudadanía que apoya esta cuenta. Pero no podemos mirar a Gaza sin atender también a lo que ocurre en la Cisjordania ocupada, incluida Jerusalén Este. Allí, bajo la impunidad del Estado de Israel, se está intensificando una limpieza étnica silenciosa pero feroz. El aumento de las incursiones militares, lo cual nos sale en la televisión, el robo de tierras por parte de colonos armados y el sistema de control que fragmenta cada ciudad y cada aldea buscan un mismo fin: la desarticulación total de la vida y la resistencia palestina. Cisjordania vive hoy bajo un estado de sitio que asfixia la economía, destruye los medios de vida y encarcela a miles de personas sin juicio ni defensa. Ante este escenario, el trabajo de Paz con Dignidad en Cisjordania es hoy más necesario que nunca. Es una apuesta por la permanencia y la soberanía. Colaboramos estrechamente con comités de agricultores, organizaciones de mujeres y centros de salud primaria para fortalecer el tejido social frente al avance de la colonización. Y redoblamos nuestro compromiso con la protección de quienes son el objetivo directo del sistema judicial militar israelí, trabajando con organizaciones que dan apoyo y asistencia legal a adultos, pero también a menores detenidos, los cuales son víctimas de barbaries innombrables, de torturas, de encarcelamientos de más de 40 días sin acceso a visitas de abogados ni de familiares, y cuyas muertes también permanecen en la impunidad de Israel. Esta jornada pone el foco en Gaza más allá de los titulares, centrándose en el apoyo psicosocial a la infancia gazatí. La visita de nuestra compañera se enmarca en un proyecto que llevamos realizando desde el año 2023, dando apoyo psicosocial a la infancia en Gaza, en toda la Franja de Gaza. Porque lamentablemente uno de los valores y de los derechos de la infancia, que es el poder ser infancia, está siendo destruido día a día. El medio de asedio más brutal de nuestra historia reciente, las compañeras y compañeros de Al-Awda siguen sosteniendo la salud mental de toda una generación que no conoce otra cosa más que el trauma y el encierro. Como escucharemos hoy de Sama Yaber, ayudar a la infancia a vivir, resistir y sanar es la fuerza más radical de resistencia que existe hoy en la franja. No se trata solo de curar heridas físicas, se trata de reconstruir los pedazos de esperanza que las bombas intentan destrozar, devolviéndoles el derecho a soñar y a tener un mañana en medio de las ruinas. Quería leer el discurso porque no quería olvidar nada. Me parece muy importante que mencionemos todo y con la alegría y los nervios de tener aquí a la compañera era posible olvidar algo, ¿no? Entonces, estamos hoy aquí, sábado 21 de febrero, en este centro cultural en el barrio de Orriols, porque no podemos dejar de hablar de Palestina. Analizaremos con voces como las de Cristina Mas, David Segarra, Lola Bañón, Tamer Cantán, Raúl Incertis o Araceli Caballero, los vínculos y valores que nos unen a este pueblo hermano. Comprender la raíz de esta injusticia es el único camino para no mirar hacia otro lado. Quiero agradecer profundamente al Centro Cultural Alquería de Albors por acogernos y dar voz a este encuentro, y también mi agradecimiento infinito a todo el equipo de Paz con Dignidad y a las personas voluntarias que han participado del encuentro de hoy y de las actividades que vamos a llevar a cabo toda la semana. También a las personas ponentes que han asistido aquí a pesar de los inconvenientes que algunas han encontrado, y sobre todo a las personas asistentes que han tomado su tiempo para estar allí y para poner conciencia y presencia frente a este genocidio. Gaza no es solo un lugar en el mapa, es hoy la medida de nuestra propia dignidad. Terminaremos la tarde refugiándonos en la palabra con la poesía Aisha bin Yusuf, recordando que si ellos no se rinden bajo las bombas, nosotros no tenemos permiso para cansarnos. Sigamos alzando la voz hasta que Palestina sea libre. ¡Viva Palestina libre! Free Palestine. Bien, ahora le daremos la palabra a Sama Jaber. Ella es profesional en administración, comunicación e incidencia política, con amplia experiencia en organizaciones humanitarias y de derechos humanos. Especialmente en el contexto palestino, ha desarrollado gran parte de su trayectoria en Al-Awda Health and Community Association, donde ha trabajado tanto en terreno como en modalidad remota como International Advocacy and Translation Coordinator y Assistant Project Coordinator. Coordinando acciones de advocacy internacional, relaciones con organizaciones socias, traducción de informes, campañas de sensibilización y seguimiento de proyectos. Es graduada con distinción en un máster en conflicto y estudios de desarrollo y actualmente vive en la diáspora. Welcome, Sama.
Thank you, Annabelle, for introducing me. Thank you for your presence. Today we are going to talk about the project Humanitarian Protection and Mental Health Psychosocial Support Response that implemented by Al-Awda Health and Community Association and funding by Generalitat Valenciana and through BCD, and the implementation period is since June 2024 till March 2026. First of all, we are going to talk about Al-Awda. Al-Awda Health and Community Association is an independent NGO that established in Palestine in 1985 and working through three major programs. The first program is the primary healthcare services, which we provided through the primary healthcare centers and services in Gaza. The second program is the secondary and tertiary healthcare services, which provided through two hospitals, one in the north of Gaza Strip and the second is in the middle of Gaza Strip. And the third program is protection of women and children, which we provided through the community centers in Gaza. A lot of challenges for everyone, not just the health sector. There is a lot of restrictions and movement for having health care outside Gaza, as much as restriction on medicine. So the situation was not that much good. But the genocide, the humanitarian context, the genocide started in October 2023. Everything became worse and worse. They start targeting the Israeli occupation forces, start targeting everything, building, For example, 80% of the houses and buildings in Gaza being demolished. We are talking about targeting all schools, even if it's private schools for UNRWA or it's governmental school. They targeted while they know that people taking school as shelters. For the infrastructure, healthcare, they targeted all hospitals. Before the genocide, we have in Gaza 26 hospitals, and now we have just 8 operational hospitals, which is not totally operational due to the restriction on the medicine, on the fuel, and all this. And the restriction of health infrastructure resulting a needs for people, not just like we are not talking about the complex injury. No, we are also talking about the basic need. For example, there is no painkiller, no antibiotics, there is restriction on everything. The massive displacement, people since October till now, they are moving from one space to another, just living in tents because there is no building to move. Also, they're doing operational on ground, which force people to evacuate. And the shortage of fuel, medicine, electricity made even the situation worse and worse. We have 200,000 injured in Gaza during the genocide, who now are dying because they are trying to find the good medicine for them. At the same time, we have, for example, 500 patients of kidney. 200 of them just died because they cannot find till now the good treatment for them. Since the beginning of the genocide, they threatened Al-Awda hospital in the north of Gaza, which is Al-Awda Tal. And on November 2023, which means after 1 month of the genocide, they targeted the surgery department, which led to a death of 3 of our doctors while they are working. And here in this photo, you can see how you have the 3 doctors and the team praying on them because they being targeted. They are Dr. Ziad Tatari, Dr. Ahmed Al-Sahar, and Dr. Mahmoud Abu Jiro. Due to the harsh circumstances in Gaza, this project funded from the government and through BCD, it supports people in the psychosocial, especially children, as they are fragile in the society. So this project ensures that conflict-affected children in Gaza have access to gender-sensitive psychosocial support services aligned with international standards. As we are speaking about the children who lost their education since 2 years and a half. They are responsible for their family because we are talking about targeting families, which means sometimes a children is the only responsible for his family, or sometimes he's the only survivor of the family. When he lost like his mother, father, grandparents, aunts, uncles, and he's the only one, then instead of going to schools, no, he's now just looking for a good food, for a clean water that it's not even reachable. Through our primary community center, before the genocide, sometimes renting some spaces just to support and give people through the projects. And sometimes because the children cannot reach us or families in general because there's no transportation, sometimes we went to shelter and displacement camps just to reach as much as possible. This project, through this project, we reached 6,739 children with just this project. As all we know, maybe like we are talking about 100 or more than 100,000 of the children who still waiting, just more projects than we can just support them because everyone in Gaza in need. Through this 6,739 children, we have 3,738 girls, 3,001 boys. We support group psychosocial support, psychological first aid, and specialized support caregiver support. So through the group psychosocial support, we reached 6,031 children who participated in this group psychosocial support. 164 children with disabilities included, as this war is affected everyone, and this genocide affect everyone. So there's a lot of children who are in need. In this photo, we can see how people and children are trying to participate. They are trying to do something they really love. Instead of going for rich food for their family, they are playing, which is like the normal thing in their age. And we reach this group who need literally support. We face a lot of challenges. Some children, they cannot just reach because there's no transportation, no place is safe. He will be killed through the way, or maybe in the place that he got this. So we are trying always to find a safe place, which is like sometimes it's hard, but we are trying our best just to reach as much as possible, just to cover the need of these children. The psychological first aid, we met 780 vulnerable children received the PFA, 80 of them is with disabilities. Here in a photo we can see a girl. I'm gonna say her name is Hiba, just as using a nickname for her. She's she's a girl with disability. Her mother just came to Al-Awda and told us that she's not playing with anyone, she's not speaking with anyone of her family, she wants just to stay alone, and she's crying. Sometimes she has a lot of nightmares. Then her mother just to assist her and support her, because while she's sitting, she's just talking about genocide, she's saying nothing, she doesn't want to eat, she doesn't want to drink anything. So after the session she take through Al-Awda, she's painting and start to interact with other children. So due to the huge percent of damage that happened in Gaza, so we have a 128 case management referrals of children. The target for the project is 100, which is the achievement is 128%, which means and show us the huge amount of needs that people need. Maybe in this project we reach this number, but with other projects we will reach more and more, because we have a lot of still cases who's waiting just a chance. The caregiver support. We think that family is the first thing in every child's life, and they are just a comfort zone just around him. So just to strengthen family, we provide 101 awareness session. The reach from parents or caregivers are 1,060, 800 women and 260 men. We ask for the satisfaction of the beneficiary. So the rate are the children, they are in Khan Younis, which is in the south of Gaza Strip, is 93.3%. The children in Gaza, 96.7%. For the caregiver in Khan Younis, we have 90%, and for in Gaza, we have 93.3%, which mean how and show how the project is successful and there is a lot of needs. The capacity building, we strengthen the local response by giving 30 hours specialized training, 46.9 knowledge improvement for our team, 40 hours of coaching and self-care session for the staff. We faced a lot of key challenges during the operational period. First of them is destruction of health facilities, which make the facility, they cannot sometimes reach the facilities. The second one is the repeated displacement, that sometimes people, for example, living in an area that the Israeli occupation published that you must leave this and force them to leave, then it takes hours and hours. Gaza, like usually in normal life, we used to cut it from the north to the south just in 1.5 hours. But due to the crowded, everyone want to displace. There is a lot of tents in the street is even being pumping. So sometimes it takes like the normal trip usually take, for example, 15 minutes. Till now it takes 3 hours sometimes, because there's a lot of people who's sleeping in the street. The tents are in the streets, which means it's hard to reach some places. The insecurity, as I mentioned before, they not targeted some spaces. No, they are targeting everywhere. Even when they say it's this is in a safe space in Gaza. Just evacuate to this because this is safe. But even when people evacuated, they're being targeted, maybe on their way to this place or in the region that they say, an area they say it's a safe. So no place is safe until now, as they said in October, last October, that a ceasefire was agreement was signed and everything is fine. From October till now, we have 500 being killed. So till now, nothing is stopped. People are still living in the tents because the border is still closed, and even if they open it, they just enter something not that much regularly and prevent them now a lot of medicine to enter, and just the medication, for example, enter just through the WHO or a private sector and not that much regularly. And the last challenge was non-approval of mobile buses. We do not get approval for the mobile buses. The mobile buses will assist us, for example, reach as much as possible of the children who are in need, really need, because we are not talking about luxury need or unneeded need. No, we are talking about the basic need for every child and their right in the international law. The impact and added value, what this project achieves: maintain the child protection services in crisis, prevented services interruption, strengthen referral pathway, and build local institutional resilience. As we don't have anyone who can work that much in Gaza, as they restrict the enter of the international organization, international staff, everything. So we need some support, and the donating to Gaza and to Palestine, which is will strengthen the NGOs there. And that's all. And they invited it 4 times, and after every evacuation, after they go out from Jabalia, the teams come back and try to work again with the basic instrument inside it. As they abducted Dr. Ahmed Muhanna from this hospital, and after 1 year and a half, they released him. Here, Gaza is the center of Gaza Strip, and here Deir al-Balah, the other hospital, it's here in the middle of Gaza, which is in Al-Nusayrat. As now we cannot work in Beit Hanun because it's still now under the control of the Israeli occupation forces, and as they draw here a yellow line, which is till now it's under the control of Israeli occupation forces, and to prevent people to come back to their houses, and which also prevents us to do our work. As for example, in Jornada, the hospital here, it's being damaged, fully damaged, and not working. And it's also in the yellow area, which means we cannot come back and work. We have here a community and health center, which means also obstruction. In Jabalia, same thing. We have a healthcare here in Gaza and community center, which means also targeted. Also now we are working from Deir al-Balah because it's something still we can work on it. As Khan Younis with the project who is working in, and Rafah we have also a community and health center which being also under the control till now. So we can working now just through this small area in Gaza Strip, which means that will restrict our movement, our work, our reach to people. Thank you.
What is the reason behind the abduction of health workers in Gaza? I mean, it's plenty of the workers who have been abducted by the Israeli army in Gaza. We were expecting that they were going to be released in the last exchange with a ceasefire, but they are still being kept in jail. So what are they doing with these people? Are they trying to get information from them? What is the reason behind this massive abduction of health workers? Thank you.
Thank you for your question. They abducted the health worker and gave them a name and that they are fighters. So they gave them this title that you are fighters, which is like unrecognized fighters, they call them. So they always like, why you, like for example, what they told Dr. Ahmed Muhanna that because you stay in the hospital. So this is like thing because they do not want anyone to stay on hospital. They do not anyone who will like assist people, being behind with them, support them, or provide them. The first thing that why they ask the people that you must evacuate this place, then we want the hospital to stop working. Then people, when they get injured, they will die immediately. Because till now, injured beings died because they cannot have a good health. So this is the thing they know, and they know that if I, for example, abduct as much as from the health worker, that means the health system will collapse, and they are trying to demolish the health system as much as they can.
Yo suelo leer a diario pues, las novedades que van publicando en redes. Entonces recuerdo que en una ocasión leí algo que me impactó mucho, entonces me gustaría saber si es cierto. ¿Es cierto que hubo un momento que los soldados israelíes prohibían a los palestinos, al pueblo palestino, recoger el agua de lluvia para poder usar agua? ¿Eso es cierto? ¿Qué ha sucedido? Porque me pareció de lo peor. Es una cosa que tengo ahí una duda.
It's just to stop any life symbol of living. So they are just trying to prevent them to have water. Till now, they just receive water which is not regularly, and the clean water is unreachable. They know if people now living in tent at the same time they do not have a good water, a good food, and it's raining on them, then this will assist them just by dying. They call it the soft killing. So they are trying to kill people as much as they can. For example, they said on media that we are allowing the food to enter Gaza, but till now what they allowing is just Coca-Cola and chocolate and unneeded things. Then how you are like supporting people who's like being hungered for more than 2 years and a half by just a chocolate and a chips? It will do nothing for them. So they are trying to kill as much as possible. Maybe like people, Palestinians being killed in multiple ways. Maybe one thing is by killing them directly, targeting them while they know they are children. The second option is killing them through prevent good food to enter Gaza. The third way is by prevent them to rebuild their houses. During the winter, now it's winter in Gaza, during the winter, and when it become rainy and storm, a lot of partially damaged houses being collapsed above their families because people, they do not have option. They come back to their houses while it's like they know it's like unsafe, but there's no place. So they go there. Then by the weather and by the wind and the rain, it becomes collapsed and they die. So now, after the ceasefire, people being died in multiple ways, or not just after that, it's during the genocide, people dying in multiple ways.
¿Cómo veis el futuro? ¿Qué va a pasar? ¿Quién se va a hacer cargo de la reconstrucción? Porque sería terrible ver presos turísticos encima de la muerte, destrucción, y que otras personas se queden con esas tierras. ¿Qué va a pasar en el futuro?
But unfortunately, like it's looking like they are doing this. We can't do nothing because we don't have power. and no one stopped them from doing this, so they are continuously doing this thing. We are like, as a Palestinian in Gaza, we are just like, I heard it from a lot of people, that they said, we are here just sitting and we are with our faith. We don't know what we should do, we know what we can do, because like we don't have strength to do anything or to decide even. Because like when they did the ceasefire agreement, it was between two parts, the Palestinian parts and the occupation part. But till now, like they do not hear the needs of the Palestinian. For example, the needs of the Palestinian is open the border, then people can go and have their treats outside, healthcare treats. Till now, they cannot do anything. So we are asking about open the border, and they do not hear us. What about like building a new terrorism things? So we don't have any power or anything to do. So we are just sat and waiting.